as you want to use terms. Okay, so who's not comfortable, someone who's not comfortable wants to give it a shot about what flexion in the hip looks like. And then we'll all do, okay, sure.
Because I had the question.
Right,
Okay.
great.
I'm doing pictures. Flexion of the hip.
Good.
Ta-da.
All right, let's all do that. And let me see, is this flexion and is this flexion? Are those the same, whether the knee's bent or straight? Is that the same flexion?
Yes, because we're talking about the hip.
Right. So flexion of the hip is talking about what's going on at this hip joint. All right, flexion of the hip. Let's do the other leg. Good. A few times just to kind of get it in there. Okay, this is flexion of the hip. All right, so somebody else who's not sure wants to give it a shot about what extension of the hip is. Yes. Yeah. So extension is this way. Okay. All right. So who wants to show me abduction, like being abducted? Adduction and abduction will sound the same. So I'm going to say abduction or abducted leg.
I'll say.
Wait, that still sounds the same. A, B as in boy.
Abduction.
Abduction. Abduction. It's being taken away from the midline, from your center, from yourself.
Take away.
All right, let's abduct the other leg, A, B, boy. I hated that in lecture in class. The whole 3 years I was in school, like, I don't know what they're saying. Okay, and then adduction would be the opposite. Yeah. Who's in the hip class? Right, so that was one of the hip precautions. Okay, all right, abduction, adduction, adding together, abduction, taking away.
Oh, very cool.
Yeah.
And that's what I'll try to also help y'all. And if y'all come up with it, I'm gonna try to give y'all little things to remember, like to help you remember, like little things like that, for learning purposes. And I was telling one year a group, the anatomy group, that I had a girl, a friend of mine in my class. She had the biggest potty brain ever, but that's how she remembered everything by just coming up with all these nasty things. And she would share them with us, and I was like, that is so disgusting. But then we like remembered it for the test. I'm not suggesting that, but if you do come up with little things that help you remember, share. Okay. All right. All right. Okay. Internal rotation. Okay. You have internal, external, medial, and lateral. What two go together? Anyone can tell me?
Internal and medial.
Right. Internal and medial go together. So she did it in the arms. Show me in the legs. Right. Turning in. Toes turning into the midline. Medial going in towards the middle. And so lateral and external rotation go together. Yeah. Yeah. So turn the legs out. External. Okay, moving away from the midline. I think it's better when you're talking to students to say external and internal, because I think lateral is confusing. Medial might not be, but anyway, you'll figure it out. And you can say both. I sometimes say both. All right, so those are the actions of the hip. The foot, you have dorsiflexion, which is flexion, and plantar flexion, which is kind of like extension. Okay? For the most part, flexion brings you into the fetal position, and extension opens you up. For the most part, and opens the front of the body and shortens the back. Flexion usually shortens the front and lengthens the back. So you could think of that. Think of the fetal position, they're in a flex position, and everything would move this way for flexion actions. I think those are all the motions. The toes would be, if the toes are up, would that be extension or flexion?
Flexion.
That's actually a little bit different. That's actually going to be extension of the toes,
Oh,
and curling them is flexion. That's a little bit different. We're not really talking about the toes too much. We'll bring them up a little bit, but some of y'all have the attachments at the foot. So, okay.
And what about the inversion and the eversion of the foot? That's the one that always.
Okay. Inversion. Think of the arches lifting in. So you're making a little house. So it's a little bug can crawl under your arches. So it's inversion, something can go in. And eversion, it's flattening. So inversion, you're creating a little space for something to go in. And eversion, it flattens.
So in the picture, it made it look like it was curling out, like evert meant it was going further than flat.
Okay.
It may, but it's this and this.
Okay.
but it's mostly looking at the arm. Well, it's the ankle of the foot, but yeah. So in and
Okay.
I have a question about that. In like the running communities, they call that like supination and pronation. Is that
There-
correct?
yes.
Or is
Okay.
that-
You can.
That's what I got confused
Yeah.
about. Okay.
There's also supination and pronation. We do not need to think about it for yoga, and there's also adduction and abduction in the foot.
Okay.
So first of all, supination and pronation is more talking about forearms, unless you're a
Okay.
runner. So supination, let's talk about it in the arms first and relate to the foot. Supination is like this, you're holding soup up.
Soup.
Yes. Pronation in the forearms is pouring
it
the
out.
soup out. So in the foot, it's the same thing. If you look at your ankle, you have this part of the ankle where the tib fib come together with the talus. Then you also have an ankle joint or part of the ankle where it's the talus and the calcaneus, and then you also have one where it's the the tarsal bones with the talus. So you have like three parts that move, and so the supination and pronation relate to one of those parts,
Okay.
and the adduction relates to the other. So in the foot, supination will be kind of like with inversion, but a certain one of those joints. That's a specialty.
Okay.
And then pronation would be like eversion,
Yeah.
okay? So like that, in one of those three ankle joints. So, because the ankle is super duper uber complicated.
Right.
So you do have adduction, abduction, supination, pronation, inversion, eversion, plantar flexion, and dorsiflexion, but we don't need to think about any of that.
Okay.
I didn't hear that.
I just said yay.
Okay. So,
Everybody said-
but that's good to
Okay.
know, right? Because then when y'all read about it, you realize it's not appropriate for what you need to know. And then it's there, and then that's what it is. And I've even seen in the shoulders, they call it adduction and abduction, but that's a bunch of baloney because all it is pronation and protraction and retraction, but that's upper body. Okay. Okay, so I think we should go deep. And so I gave y'all's group the piriformis. And then I'm going to leave y'all, and you're going to do then we'll come back to the lower legs. So we're going to start with the piriformis, and then I want y'all to present it. So you're teaching it to the group, and then I'll try not to interrupt at all, and just kind of make notes if I need to, add or correct. Let me get
I was gonna bring it over to y'all.
let me get my legs. Okay, wait.
With all this stuff.
What color do I start?
A piggy, sure.
No, you must do both sides, just the one side.
This is what we're gonna do. Let's do one side.
Right there.
If somebody really wants to get their hands dirty,
No, don't put me in
you
front.
can come and try to do the
Well, I
other
was sitting in
side.
everyone's way right there,
Yeah,
where I was sitting, so.
And also, who has the time? Is it 9?
9:20.
Okay, so we're gonna. Okay,
That's all.
we gotta get them all covered.
Okay. Go ahead. Origin insertion.
Okay.
Piriformis.
The origin of the muscle is at the sacral plexus.
Ta-da.
We are going to attach it then to the midpoint of the sacrum. It's at the mid-sacrum.
That's the origin.
The origin
And insertion.
is medial side above the head of the femur at the greater
Here's
trochanter.
the greater trochanter, and it's back in here, right?
It's under.
It's kind of on top, isn't it? Kind of sitting on top of that. Isn't it?
Kind of like right
Oh, yeah.
up here,
Mhm.
up here. Okay.
So and then.
Yeah. Let me just,
And write notes, you guys, because I'm gonna be adding some information to it.
in here.
Get your papers out.
Okay.
Yeah, I think, well, yeah.
Can everybody see it?
Yeah.
Its action is, go ahead, you guys want to?
Abduction,
So abduction, its action is abduction. Go ahead.
lateral rotation of femur with
Lateral
abduction,
rotation.
and extension.
And extension. Everybody see that? It's abduction, lateral rotation.
And extension.
Okay, so poses. That's.
Okay, before we go to the poses.
Yeah.
Okay. The piriformis actually inserts to the anterior sacrum, so it's in the front.
It was in there.
It's in the front, so we can't touch it. Now, we can all palpate our sacrum. Does everyone know where the sacrum is? Go back there and feel it. The piriformis attaches to this is the posterior sacrum, attaches to the anterior, so it's deep, we can't get there. Okay, so it is the only muscle that attaches to the anterior sacrum. Or originates, or whatever. Well, it's an attachment form, so that's the origin, but it's the only muscle that touches that anterior part of the bone. Okay? The piriformis.
Did you want to start that down?
If you want to. It may be on the test. But the thing is, y'all are going to get the test before you know, so you can always look it up and get it. Okay, so it's a very deep muscle. We cannot palpate it. It's a common source of problems in the pelvic area and the SI area, and the common source of pain, because if it's too tight on one side, it tends to be tight. If it's too tight on one side, it can yank on that sacrum and cause issues.
I have that.
The sciatic nerve runs through that?
Yes, the sciatic nerve either runs over, under, or through for the unfortunate one. Because it can get squeezed more easily if it pierces through the muscle. And that's a discrepancy in anatomy. It's not exactly the same for everyone. This is general, but for some people, the sciatic nerve comes over, or it'll come under, or like I said, for the one with the bad karma, it'll go through. And then they will have piriformis syndrome. Okay? This muscle is really more a muscle active with walking. So she showed you all the movements. But this muscle, when you're walking, when you're moving that foot forward, the legs forward, it helps abduct a flexed leg. So its action is abduction away from the body while the hip is flexed, and external rotation while the hip is extended. It turns out. Yeah, let's talk about the right leg. When the right leg moves forward, when the hip is flexed, this muscle abducts the leg too. But when the hip is extended, it externally rotates. So it's a muscle active when you're walking. And it's really hard to understand it, but when you're walking, if you're right, like, let's look at just my right leg.
Turn so that you're facing with the right leg out.
This leg. When I'm walking, if my foot didn't, if the piriformis didn't slightly abduct the leg, I'd fall over because I'd have a narrow base of support. So it helps you from falling over, and it's very subtle. It's abducting now. Now it's abducting. Okay, so I'm going to walk with this leg. Abducting, externally rotating, abducting, externally rotating. It's just a muscle used when you're walking. That's really all you have to know. It's very confusing. It took me a long time to understand what was going on with that muscle. It's active
like a
door.
This is what we were talking about. Is it kind of like a little door? It kind of opens and closes just a tiny little bit.
Yeah, well, I guess you can think of it that way, yeah. It's just you need to know that when your hip is forward, when your leg is forward, when the hip is flexed, it does something different than when it's extended. Can anyone? Okay, now I'll let y'all show the stretching and I'll tell y'all why the stretch is the stretch for it, because the stretch also confused me. Any questions before we continue? Anything I need to clear up? Does that make sense? Okay.
We said to stretch pigeon. Anything that got really deep.
Which side is it stretching?
The forward leg.
Okay.
Anything that got really deep into the hip joint there. And
Agni Stambhasana.
so those were the two we said. And we also talked about things like lizard and gecko that got really
Show
deep.
me that. What's lizard?
I had actually said gecko where we got really low again into that very forward hip joint. So,
Okay.
forward into that.
Okay, so
Enjoy
if let's think about this, and this is the thing about that I want y'all to understand. I want y'all to think about the muscle, because if you just rely on pictures or what you're reading, also, that's not functional, number one, and you'll never understand it. You want to understand and not memorize. So let's think about this real quick. If I said that the piriformis abducts a flexed hip, isn't pigeon abducted, right?
Yeah.
And flexed, so how is it stretching it? It is, but how? How can it do that? If it works, when I'm,
Because it's up at the, it's because it's up.
yeah,
Well, your
It's the
calf
height
is-
of the
you've got
leg.
your leg turned so that when you're bending forward, you're getting a stretch through, even though you've got your leg, you're abducting, you're still bending forward, so the action then would be a flex, right? So, am I totally?
I appreciate the effort.
I feel what you're talking about. I see what you're talking about, and I feel it, but I don't know how to put it
Aren't you
into
kind of
words.
moving it, I mean, if you're stretching something, you're moving it in two different directions. So if you're pushing your knee forward into pigeon and all of this forward, but yet you're bending forward, you're forcing your hip back, which is then going to lengthen those muscles in that area, which would stretch it.
In order to stretch a muscle, you have to pull the ends in opposite directions. However, in order for a muscle to work and contract, the ends come together. So if it contracts, if it abducts a flexed hip, this is also flexion. And when you do this, it is external rotation, but it's also abduction, right? So if it contracts and shortens in flexion and abduction, how can we be stretching it in flexion and abduction? And the reason why, and y'all need to know this, because I started looking at the piriformis stretches, and I'm like, okay, if I understand origin, insertion, contraction, this does not make sense to me for it to be a stretch. And that's because when the hip goes past 90, the action of the piriformis changes and becomes an adductor. Okay?
So
And
90
it becomes
ab.
well,
90 little head.
Well, above 90, it becomes an adductor and internal rotator. And that's what's tricky about the body. When this moves here, the position that it's in changes, and it shortens in adduction and internal rotation. I don't completely see that, but that's how it works. And so that's why pigeon, because you're past 90, is stretching it, because it's lengthening it because the action changes past 90. Okay?
Can you
the
show
re-
it on the skeleton?
this won't actually do it because it's just tape.
Well, the
But when
tape,
it goes-
the tape will pop off, right?
Not necessarily, not necessarily.
Does that also have to do with where its origin is? Because the hip is up past 90, you're getting a stretch because it's in there? Does that make sense?
I mean, it's wrapping around tighter.
Right.
Yeah, when it's past 90. I guess when it's past 90, it's just it changes where the muscle is in place. I don't understand it, like I don't see that, and I'd have to get like better tape, and it'd have to be stretchy in order for it to really work. We'd have to get something stretchy, maybe a TheraBand next year. We can start using TheraBands, actually, that's an idea. Okay, I got an idea.
But for somebody who is not as flexible, then they don't have to go past 90 then. Necessarily to get
They do
as much
because-
effort out, I mean to get the stretch if they're maybe because you see people that can't get as far into their pigeon stretch,
Right,
but
and
they're
the
still
reason-
are they getting
The
enough?
reason why they can't get that far could be because of other muscles.
Okay.
It could be because of the shape of their hip joint.
Okay.
It could be lots of other things.
But then they're not getting the stretch here. So they're getting the
They
stretch in
could
other
be.
places,
They-
but are they not
They
necessarily
could, well, they
getting
could
it?
be, or they could be getting in layers where they need to be first before
Okay.
they go there. Some people need to work here
Right.
before they go here, before they go here. But the reason why I wanted to tell y'all, this is a tricky muscle. It's not going to stay this tricky. Other muscles are going to be more straightforward. The reason why I wanted to tell y'all is because if you get confused, if you start to understand a muscle working needs to be lengthened and go in the other direction for stretching, and you read one day, you're reading about the piriformis, and you know these are piriformis stretches, and you don't understand how come it can stretch in the same way that it's active, it's because past 90 the action changes. And you don't have to really know any more than just know that, and know that that piriformis stretch for real is a piriformis stretch, even though it might not make sense with the action. Okay?
Well, Maggie, isn't thread the knee? I mean, this is basically at 90. This is getting into the piriformis, right?
Sure, at 90 or past, it's going to get
Okay.
piriformis, yeah. Do y'all understand what I'm saying? So, it's something that I finally figured out after years of not really understanding why are these piriformis stretches, and I wanted to share that with y'all to save some confusion. Even though you may feel confused now, you'll one day maybe it'll be like, I get it. So that's a piriformis stretch pigeon. Agni Sambhasana. Okay.
We said for our strengtheners, we said Ardha Chandrasana. Just because you're in extension, you're in the adduct.
External rotation.
Yeah, external rotation.
So go into Ardha Chandrasana.
Right.
This leg is not really extending. Extension would be back this way. This is really abducted. Does that make sense?
Because it's straight rather than
Well,
going back?
Well, right. Extension of the hip goes back this way and contracts the glutes. But in Ardha Chandrasana, you're abducting. Do y'all see that?
You can just run out, yeah.
You're moving to the side. Okay, so not really. It's mostly active. The piriformis is mostly active from walking, and it's mostly going to be tight on people. So we don't have to work on strengthening.
And it's not. We said the other one is Vrikshasana. Just didn't we say that? Vrikshasana.
We did.
Because of this.
Yeah. Okay. So I was talking to Bracken. She has some really annoying muscles because some muscles we don't want to strengthen. We don't need to strengthen, and some muscles we don't want to stretch and we shouldn't stretch because they're just like, well, you get to the upper body, especially like this, one of the rotator cuff muscles. So the piriformis, I would leave alone and focus on stretching it. It's going to be mostly tight for people, and I would focus on not just stretching it, but balancing the sides. If someone feels uber duper stretch on the right and not as much on the left, they need to address that because it's going to cause imbalances. So for piriformis, I would say focus on stretch and focus on balancing that muscle.
What would Utkatasana do to that muscle?
Utkatasana, glutes are mostly going to be working in Utkatasana, but let's see, if Utkatasana is like this, and the muscle really is it's active when walking, so it's a little bit abducted in flexion, so you're in flexion but not really abduction, so part of it might be shortening, but I guess if you're in Utkatasana, like a really low one, you get to maybe strain it a little bit, but then if you think about Utkatasana, you're kind of adducted. I would not apply piriformis or connect it to Utkatasana.
Okay.
And I will say, a lot of what we know about muscles is because it's origin insertion, but also there have been EMG studies where you stick a needle in the muscle and you move the body in different ways, and it makes the needle move a lot if the muscle's active. All of your muscles are active to a point in everything that we're doing, pretty much, unless you're in Shavasana and then they're still active. But, so I would not think of the piriformis that way. I would think of it more as a muscle used with walking, tendency to be tight, tendency to cause piriformis syndrome. You'll hear about that muscle is the culprit there, and work on balancing that muscle out. Okay?
Do you have anything else that you would recommend in terms of a pose besides pigeon?
Pigeon, the one on your back where you cross over like this and hug your knee in, Agni Sambhasana.
Okay.
I would think,
Some of the twist.
yeah, even this one because it's major internal rotation.
Right.
And when you go past 90,
Right.
hold on, if it's an adductor and internal rotator, this does get the piriformis, but because you're moving this kind of away from the sacrum, so it's because it's a twist, it does lengthen it that way.
What about Supta Padangusthasana, where you take the leg across the body?
How about the reclined twist?
Yeah, I would think that would be one, and even if you were
More
kind
down.
of more down, might get it more than more up. Anything that stretches the side of the body because it wraps around the side may get it a little bit in twisting, but not side bending. Any twist that stretches that side because it crosses over that lateral hip out here. So anything that lengthens that would stretch it. Anything that would stretch really, I would say, the gluteus medius and minimus, and even the glute max. Anything that goes along that same path may get the piriformis a little bit too. And for different people, they need a different degree of that stretch, like you were saying. Okay, but the main things is the muscle active and walking tends to be tight, tends to be off balance, and will be the cause of piriformis syndrome if someone has it. Okay, let's skip y'all's other muscles and now go to muscles on top of that. So the muscles that go on top of that. Oh, there are. Did y'all have to color the external rotators, gemellus and obturator?
Yes, the obturator.
Okay.
Yes, that sounds familiar.
The obturator internus, externus, and gemellus. There's 2 gemellus muscles. Those go with the piriformis, sort of. They're kind of considered external rotators of the hip, but they're really deep and they're really small. Open it up in your coloring book. I want you to see it in the coloring book. Anybody have a page number?
60 has gemellus and inferior.
61.
There's one that will have all 4 of them.
I don't think so. Mine's on 61, but my book is older.
61 for the 3rd edition. Okay.
And 69.
If it's 61 on the 3rd edition, it's 59.
Okay, so those muscles are external rotators and they're sort of like in this little foramen, obturator foramen here. Don't worry about those. Those muscles, you see how they're big in that picture? They're about, all of them together are about this big for real in a body. So I would just know that you have really, really, really deep. Those are even deeper than the piriformis, and they only assist in external rotation. They're just there. They're, the deeper the muscle, the more of a kind of like a core muscle. So it's there. We don't try to strengthen it or stretch it. It's going to get strengthened on its own just by addressing the outer, bigger muscles, okay? So you do have deep external rotators, and you won't have to know about any more unless you're doing some kind of research with anatomy. But for yoga, we don't need to know anymore. All right, so the glutes. Who's the glute group? All right. Any questions on the piriformis before we go on?
Would you, if you were in like a down dog split with the top hip stacked, would you be, would it be on, it's on flex in that position?
Well, if it acts as the external rotator in extension, so if you're taking the leg up and extending it, depends on how you do down dog split. Are you stacking or not stacking? So if you're stacking the hip, it's more, I think it's more abduction. Okay, so it's more abduction unless you go that way. And we don't recommend that too much in down dog split because of the back. So you're more, that's more abduction, I think, than extension. Or neutral. Do you see that? This would be flexion of the hip, between the hip, and this would be extension, and you're more neutral.
So if you bend the knee
I
and
would
drop,
say-
if you bend the knee and drop, like,
That's more stretching, that's more focusing on hip flexors up
Okay.
front. And so it is extension. I guess in piriformis is a little bit shortened. This, bend the knee again, externally rotate your leg like that. If she's externally rotating and extending, that's when it's fully active, because remember it externally rotates in extension. So you could do that, but your main focus in this pose is to stretch the front, but not to work the glutes.
Yeah.
Does that
Yeah.
make sense? So yes, it may be a little contracted here,
yeah,
but it's mostly
not really
a
what
muscle.
you're working on.
No, and it's mostly a muscle that's kind of, its fire is when it's walking, when you're walking, okay?
And it externally rotates.
It externally rotates an extended hip. But when it goes past 90, it becomes an internal rotator. And that's the thing about muscles, they're not like this and like this. They're like this. And so it makes you like this. Okay.
Let's start with origin and insertion.
Sure. Oh, wait, which one are you starting with?
The maximus.
Well, let's start with the deeper one and layer it.
Okay,
Yeah.
sorry. Then I'll start with the minimus. The origin is the outer surface of the ilium below the anterior to the gluteus medius origin. So he is somewhere in here, attached to here.
Yeah.
Insertion is anterior portion of the greater, I'm gonna say trochanter.
Yeah.
The action, it abducts and internally rotates the thigh, slightly abduction of the hip joint. Should we demonstrate it? Let me share it.
Okay, I would like you to, are you gonna tape it? you said real specifically the anterior portion of the greater trochanter, right?
Interior.
Is that what you said? Anterior?
Yes.
And that's very specific. If you can remember greater trochanter, and we're going to palpate that when he's done taping, that will be good enough. I mean, because it is good to know it's more anterior because it'll help you also learn that it's medial rotator too, but I'll give you its main action when he's done taping it. But some of these will say slightly anterior, 2/3 anterior. Certain anatomy texts will give you more specifics. I made mine gross trochanter, greater trochanter. So, and we'll palpate that. Is it hot in here to y'all? I feel the heat like blasting.
It feels very
It
good.
feels rigid. Really?
Yeah, and right here it's really cold.
Okay,
As soon
okay.
as the heat turns off, then it's gonna be like ice cold.
Okay, I'm gonna get something to drink. I'm coming.
Hi Kevin, will you repeat what
Yeah, where did you say the origin goes?
Yeah.
Origin is outer surface of the ilium, below and anterior to the gluteus medius's origin. So it's underneath the medius, is that correct?
The minimus is under the med.
Correct. Yeah.
Okay, is that it?
Yes.
Okay, so let me help. Okay. It's well, it's good. But it's a fan. So I'm gonna fan it out for you.
Okay.
You just have cool jars.
I'll do that. Okay, it's a fan, so it looks more like that.
Okay.
And it crosses over the hip. And so look at where it is, you guys. If it shortens, and that gave me a great idea using TheraBand, but if it shortens, this shortens it. Can y'all see that? This would shorten it.
Like insertion moves towards origin.
Yeah, insertion moves towards origin, but if you see where the muscle is, you can see if this starts getting short, it'll pull this leg up. Or this down, but and this will make more sense because, you know. Okay, so it's an abductor for the most part, but because you said it was slightly anterior, it also helps a little bit with medial rotation. But really, it's an abductor. That's really all you need to know about that.
Abductor.
Yeah, like aliens. I'm going to say abduction alien because it really is hard to hear what I'm saying. Okay, so, and it's more like a fan, and it's the deepest of the glute muscles. All right, were you going to say anything else about it?
I don't believe so.
Okay, y'all want to palpate the greater trochanter? So it's a bone that sticks out here. So if you stand and do like this and just sort of hit the side of your leg, you'll feel a big bone here. No matter how big boned or small boned, you're going to feel a bone. Okay, if you kind of internally and externally rotate, you'll feel it rolling under your hand. Okay, that's the greater trochanter. We can feel that. Can we palpate the lesser trochanter?
No.
No, because you got all this in here. Whether you got a lot or a little, you got enough to where you can't feel it. Okay? Because it's in here. We can't palpate that. But that's our greater trochanter. Okay?
So it's just the bulbous point, I mean, of this of the femur.
Yeah.
I mean, it's just that
It's a bone.
knobbly piece.
Yeah, right.
That's mine.
That's fine. This whole thing is a greater trochanter.
good.
And it's good to know because a lot of things, insert there.
Yeah.
And it's a good point of getting oriented in the body.
This is what constitutes. This is what side Buddha pose, or recline Buddha.
Yeah.
Recline Buddha. Carolyn, you know the recline Buddha that
What?
Kiersey always has us do? It says trochanter that prevents you from
That's greater trochanter.
like when we're like, see, I can't do it.
Oh, that's Anantasana or something. Okay, I didn't know that y'all called it recline Buddha.
But I can't do it because of that trochanter, like you said, it just.
Okay.
You can do it, you just gotta
So
have
what
blankets underneath.
Isn't that an Anantasana?
That is what it's called.
Okay.
Vishnu's couch.
Yeah, Vishnu's pose, or recline Vishnu. Okay, yes, recline Vishnu. Okay, that's another thing about yoga. It has become so, not contaminated, but It's just not its original anymore, and that's not a bad thing, because I think a lot of original yoga poses need to really be addressed. But what would you do if you have a student who's trying to do Vishnu's pose, or Buddha's reclined Buddha, or Anantasana, whatever you want to call it? What would you do if their greater trochanter is bumping into the floor?
Put some blankies on her.
Put some blankies.
Bam.
And if they're like, if they are worried because they're in pain, it's like, it's just your bone. Don't worry about it. You need some blankies. Okay, good. All right. So it's an abductor.
I have a question. What do you mean when you say
Palpate. Well, to touch it and feel it contract.
Rubbing.
And this is palpating.
It just means to feel it.
And do you know that every year somebody asks me that? So it's not, and other people are wondering the same thing. Okay, next, medius.
Okay, so the medius, the origin is the outer surface.
Sorry. How do y'all want to present the yoga poses after y'all are doing them? Because they kind of go together.
This is the
Right.
minimus.
Let's do those. Yeah.
Okay.
Yeah. Okay.
It's the outer surface of the ilium, below the iliac crest, and anterior to the origin of the gluteus maximus. So,
Wait, you're doing the medius?
mhm.
So what'd you say, Max? What'd you say about that? Sorry.
Oh, I was just saying it's the where it originates is anterior to where the maximus originates.
Okay.
So it's forward of the maximus. And then the insertion is the I can't read the name. The superior surface of the greater trochanter of the proximal femur.
Say that again.
It's the insertion point is the superior surface of the greater trochanter.
Okay, it's at the greater trochanter, but she's saying it's superior, it's a little higher. So, yeah. So it's attaching maybe a little higher, and a little more to the side.
Over the minimus.
Tape over, and so she said, read the origin again.
Okay, the origin is the surface of the outer surface of the ilium below the iliac crest.
Okay, this is the iliac crest, right here. So it's a little below that. So it's above, like the minimus is a little bit here, the medius is a little more, and the glute max will be even more of it. This is the crest. We can feel the crest on ourselves. It's just at the top of your pelvis. So if you go into your sideways, below your ribs, and push down this. Yeah? Anybody need help finding it, let me know. It's kind of, if you go into your waist and push down, you'll feel the ring. You might not feel as good standing. I mean sitting. Sorry.
Come on.
Sorry. It's there.
Just your hips.
Yeah, it's part of your hips. It's your ilium. Your ilium makes your femur. So it's just pelvis.
Cute.
This is where your hands rest on
You
the
think it'd be possible?
Yes,
This isn't
it's where your
really
hands rest
good.
when you're standing, but on the top.
Posterior, it's like here.
Yeah.
Posterior.
It's below it though.
It's a little bit below.
Oh,
Okay.
So it's just laying right on top of the, so they're just laying on top of each other and they're just stretching a little bit more each leg. Yeah.
Lower one.
Yeah.
Point. And then here's medial. These, yeah. Right. The yoga pose?
Let's see, the function of the medius is it stabilizes the pelvis, or it helps to stabilize the pelvis, and it helps abduct the hip joint and rotate it medially. Good.
Adduction.
Say that again. It's an alien.
Adduction.
It's an alien.
And medial
And a medial
rotation.
rotation.
Yeah, and it's mostly an alien.
What does it abduct again? The pelvis?
The hip.
The hip.
Stabilizes the pelvis.
And it's stable, yeah. Can you show us on there what that does? So it's abducting and internally rotating.
It assists with internal rotation. It's mostly an abductor. So it's doing this. Same thing as the men graphing. And a little like this.
Does it do anything different than the men?
No, they're the same.
Okay.
The max is going to be a little different than those. Okay, completely different than those actually. Okay, the gluteus medius is a hot topic. Though I think it's a good one to add to your yoga practice. I think it's one of those actions, and you did a lot of those actions. Remember, you were like, "Is this it?" It was thinking it's extension. I think it's a really good one to start to incorporate into yoga classes because, as a physical therapist, one of the biggest problems I see with people as they age, and that could be 30, 40, 50, or 60. I mean, as we're, out of our 20s and we're not spring chickens anymore, the gluteus medius, for whatever reason, tends to be weak and can be a real big source of hip problems and needing hip surgery. Now, there are other reasons for needing hip surgery, but if your muscles aren't right around your hip, that's not going to help. Look at it. It's deep and it's right on your hip, and it tends to be weak, so it needs to be addressed. So you need to do, I would recommend incorporating more abduction into your yoga classes, and we'll talk about those right now because they're going to present them. But I'm going to walk, and I want y'all to see me walking. I'm going to walk this way and that way. There's a way to see it. Those of you who want to work with geriatric patients or students, those of you who are going to maybe see more of this, but even if you don't work with a geriatric group, you still want to address it as a preventative thing. That's what yoga is preventative also. And it's not, I'm going to say it's better as preventative, but most of you are going to come across people who are preventative. If when someone's walking, they have a weak glute med, you'll see two types of gait, which is walking. Gait is ambulation. Ambulation is one. You'll see two types, and you'll start to notice it in people on the streets and stuff now, and it's pretty interesting. When someone is walking, let's look at the right leg. If my glute med is weak, then I'll either be walking like this, like that, okay, or that's called a glute med lurch, a Trendelenburg, or I'll be doing this. Y'all seen that, right?
Oh, yeah. See that a
Okay,
lot.
that's a weak glute med. If you're leaning to the right glute med is weak. If you're doing this, the right glute med is weak. The reason why, this is, focus here, this is kind of confusing, but if you look at my body, if this muscle is an abductor, okay, if it abducts the leg, when I walk, if it's too weak to abduct the leg, then I'm going to do like this, which is throwing me into adduction. Y'all see the leg in relationship to my body because it's too weak to stabilize it. Does that make sense? So it's an abductor, and when I'm walking, it throws me into adduction because it can't keep me abducted and stable. Also, the other compensation, when someone's walking and they do this, okay, they're doing this because that leg, they're trying to if this is abduction and it can't do that, then it's throwing the shoulder over. And if you look at this angle, if you look at abduction, this angle here is, right, this is bringing the thigh, these two upper and lower side bodies closer together. And if it can't do that on its own, then I use this to bring these two sides closer together. Okay, it's a little confusing, but that's why it does that. Well, for me being sort of dyslexic, it took me a while to really comprehend that.
It's like overcompensating.
It's overcompensating.
Your body compensates. Right.
So you want to prevent that. A lot of times there are other issues why that muscle gets weak. Alcoholism can cause hip problems, and they can cause weakness in those muscles and all kinds of other things. But geriatric group and preventative reasons, you want to address that muscle because it is a really big problem in its tendencies to be weak. So these poses that we're going to talk about are going to be really nice ones to incorporate for it to be very therapeutic. For those of you in Debbie's group or the Midtime Yoga group, because yoga is just all together therapeutic. So, what muscles did you? Sorry.
Do we know why alcoholism causes hip problems?
Because there's a artery, the femoral artery that comes out of the hip right here, and out of this bone, out of the head of the femur, And for whatever reason, with alcoholism, you get neuropathy.
The neuropathy issue.
Yeah, you get neuropathy. So in certain vessels in the body, you lose circulation. Toes and fingers start to get neuropathy. That artery is affected, and so it cuts circulation off and starts to cause necrosis and breaking down the cartilage in the bone.
Is that why your nose gets right with the?
Yeah, maybe.
It's a circulation.
Yeah, it's a circulatory issue.
All the matter.
Some people have a femoral artery issue just genetically, and so it's not because of anything going on, but it's just there's a lack of circulation there. So for whatever genetic reason.
Did you want us to do the poses for these two or move to the gluteus?
Let's do those two because
Okay.
Max is doing completely different actions.
Okay, so for the gluteus minimus, I have for strengthening.
Well, we're gonna address them together, right?
Okay. Yeah.
So for
There's
okay.
different poses for each one, but we can just.
But they're gonna get both of them because their
Right.
actions are exactly the
Right.
same. Okay.
But for both, then I have the 4-footed tabletop, which is Chattis Pada Pitham. And then
Show us.
This is for the stretching.
I'm gonna take my socks off.
Okay.
Are you doing stretching or strengthening?
I think it's a
Strength.
Oh, this is
I'm gonna start with the stretch.
Let me start with the stretch. So I have the belly twist, which is Jathara Paravritti.
So we're doing stretching first? We're
You're doing the stretching now.
Okay.
Because of Lindsay.
We had a request.
Like this.
Which side?
Stretch it here.
Okay.
And my glutes.
Good. And why is that stretching it? Because y'all want to.
Because it's
You
taking
know-
the origin and the insertion away from each other.
Right. Well, and what is this? What is this thigh doing? Is it add? Is it
Add, AD.
It's adding.
So it's in the opposite direction.
It's going in the opposite direction of its action because actions will shorten it.
Okay, so the stretching is left hip, the top hip,
Yeah.
or glute.
And what's that called?
What was the number?
Jathara
Jathara Parivriti.
Parivrtti.
Parivriti is all the revolve stuff.
It's the belly twist.
Was there a third word, or was it just Jafra for Ricky?
I think there's a variation when you use your other leg, because that one is just strictly the.
I'm not gonna lie, I don't know. I mean, I know a good bit of Sanskrit terms, but there's so many like other books now and Sanskrit words coming out of I don't know where, and I just don't know. I got 2 kids. I haven't. Yeah.
I also have Ardha Matsyendrasana, which is how 4 of the fishes.
Yeah. I know that one. That was in the basic Iyengar book. Why is that stretching and which side?
Top leg.
His
And
top leg, and it's the same as when he was laying.
So would it be any revolve pose?
And then I also.
well,
I haven't thought of it that way, but anything that adducts the leg is how you
Yeah.
want to think of it.
Okay.
Yeah.
And then I also have Garudasana, which is eagle, which I've never done in front of a bunch of people.
That's when you do in private.
I can't do the.
Which leg?
top leg.
Look here. That may work well. I mean, when I think of Gerd, I think of that as a hard pose.
Minimus and minimus.
It is.
But the top leg
Yeah.
are taking into
Yeah,
stretching.
Yeah.
Yeah.
And you have to have flexibility in that muscle, so that's a good thing to think about because before you bust into Garudasana in the first part of class, you may want to do a little stretching for the glute med so that they can better get into that. And see, your classes will make more sense if you understand the muscles and maybe if you do your classes by having a theme and the theme being a pose, it'll make more sense to class because you'll know how to warm them up a little bit better if you know the anatomy.
I also have Paravritta Janushirasana,
Okay.
revolved head to knee.
Uh-huh.
Not so much.
No, because it's a little bit abducted, alien.
Okay. Let me scratch that.
I mean, it's a great one for other things, but I wouldn't really make that a really,
How about Paschimottanasana?
show me.
That's procerita part.
Yeah.
Oh, wait,
No.
let me see that. Oh, this is the forward fold, that's right.
Paschimottanasana.
Well, that's really flexion of the hip,
Okay.
so it would stretch the extensors of the hip. It's not really a side, away, in, and away kind of
Right.
action,
Okay.
so I would say no. Not to say that muscle isn't being affected in some way or shape or form, but it's more of a, I mean, it's a super duper flexion pose. So
Right.
it stretches the extensors.
So it's
We are
primarily.
stretching.
Would Apanasana be a stretch, or is that too much?
Okay, when
not
y'all
enough to
when y'all say the
side?
word, you gotta show the thing because first of all, I don't know if what you're saying sometimes. Not everyone knows these Sanskrits, and there's like millions of them. So
Okay, if you're doing like knees to chest, basically, would that be too central? Like to stretch, you need to be out to the side.
What's the
More
pose
energy.
again? Can you show the pose?
Oh,
please?
sorry. Had me.
you're talking about Navasana?
No, I was talking about Apanasana.
Okay.
She's just
So-
talking about
Just
lying.
rolling.
Just go
Yeah,
ahead and
just
show
like
it.
just
Apanasana is when you're lying down on your back.
Okay.
is that too?
It's a hip flexor, and this is an
Okay.
abductor.
Okay.
So you want to be really past midline.
So it's primarily twisting poses.
Did you ask me that? Yeah, you asked me. I haven't thought of it that way. Anything that adducts that hip is going to be a stretch for the abductor. Anything that adds will be a stretch for the alien. That's how I would think of it because, and you can think about all those twists and let me know. I haven't really sat and thought of it that way. I just know the action, so I know what will stretch it.
Right.
So why would this stretch it if the action is this? This would. You go on opposite of the action.
What about
Think of it that way.
What about Purvottanasana first? So if it's Purvottanasana.
Yeah, that's what I put.
Yeah, I can feel it.
Okay.
But for the front leg.
This is Parshvottanasana.
Yes.
Yeah. Oh, okay.
Say yes.
Well, hold on. Come into
Are you
this.
saying yes?
She didn't understand that.
Okay. Yeah, you're asking if we're stretching it here.
Yes, here on this leg.
Okay. So this is getting that outer hip if you're doing it right. Have y'all seen students that do this?
They do like this.
Yeah. So I haven't really thought of it. It's more like a I would say
Stabilize?
IT. No, it does get it is a super stretch down here up on this side. It's more like oh god, I want to say IT.
Or
It's
to
sort
the
of stretching
side, into the back.
Yeah, no. I mean, you're getting the glute max, and the glute max attaches right in here.
Yeah.
It attaches here, so it may be getting some of that insertion part of the glute max because the glute max is on major stretch right here because it's an extensor.
But the mid and the medius are more in the back.
No, they're on the side.
They're on the side.
Oh, okay.
Yeah.
So you're
They
feeling when y'all do this, y'all know what she's talking about, that super duper feeling of stretch on the side.
Yeah.
I would think it's more the max because the max is being stretched in extension here. It's being flexed or stretched here because it's an extensor, okay? And it attaches here on the side. So when you're really, if you do this,
Right.
it's more like an abducted leg. When you do this, it's more like a flexed hip. So glute max is an extensor and this is flexion. So I would say that side feeling is probably the insertion of the glute max, but there is a major side stretch there.
Yeah.
And it may feel deep and it may get a little bit of the mid and min because they all insert in that location. But if you're
That's primarily those external muscles.
it's a deep flexion one.
Yeah.
But you see, if it's done correctly, you won't get that stretch unless you pull that in. And a lot of people don't have that good external rotation they're supposed to have. I would really think that is the insertion of the glute max that's being stretched when you go into it correctly, which puts you, and it squares those hips
Right.
into more of that flexion. Do y'all want to try Parshvottanasana real quick? Let's do it. Just kind of take your socks off. And let's start in a lunge, okay? Let's start in a lunge.
Try it without slipping.
It won't work. You won't get it. You won't feel it. I'm sorry. You won't feel it. Start in a low lunge with your hands framing your front foot.
You're not gonna get it.
Now listen, we're not warmed up. So ease into Parshvottanasana, straightening the front leg. If you got socks on, you're not going to get it. Sorry. Now, take your outer front hip, because I don't know, you might have your right or left foot forward. Take your outer front hip and move it in towards the socket so you're externally rotating that front leg. Externally rotate that front leg. That's bringing you more into hip flexion versus sort of like hip abduction.
Who's doing the hamstrings?
Do y'all feel that when you externally rotate that front hip? That's bringing you more from like abducted side body to a flexed body, which is getting more a stretch in that glute insertion. It would be more like this.
Do the other side.
That's definitely good.
Your leg may be farther out.
You should probably do it.
Just okay.
I'm so tired. We did so many. What did we do? Step back and down.
Yes. You're getting max, mid, and min.
I like that stretch.
Yeah, okay.
That's a good one.
Yeah, okay. All right, hold on. Christy has a good one to show y'all for all three muscles. Did y'all see? So if you're in Parsvottanasana and you're kind of like Willy Wonka, like your students are going to be doing, or some of you were doing like this, it's kind of more abduction if you can see it. It's kind of like this. So when you adjust this and make it more that you're flexed and move it more into the midline, it's like it brings you more into flexion. And if you're feeling that side thing, I would say that's an insertion of the glute max.
I have a question. Would burning log stretch?
It may a little bit because if the no, because they're abductors and burning logs is more of a it is an abduction, so it's sort of shortened there.
Oh, okay.
Yeah, you see how this is abduction and this is
Right.
abduction. You're getting some of the piriformis though. Remember that?
Yeah.
And you're feeling all that in the butt. Okay. Show me.
I can't.
Wait, what you said? What did you say about Gomukasana? Gomukasana.
Yeah.
Okay.
This one.
Yeah.
Right.
Yeah. I know that one. I just didn't hear you.
Okay.
Yes.
That's on the lower body.
Yeah. Big
It's a
time.
smiling cow, right?
Cow face.
Yeah.
And the
Or some might call it
Uttanasana,
smiling cow.
so the Uttanasana one I showed you.
Yeah, so Christy's got one for all three of the muscles. We haven't done the max yet, but we know that the max is an extensor. We're going to talk about it more, but so
So if you're in Uttanasana, you just step 1 foot behind, and then I bend the front knee and draw this hip back.
which is some people don't need to do that. Some people will feel stretched without doing that.
Right, or you can have your hands on blocks. Yes.
Yeah, so go into it. So what's happening in okay, so she's doing the bent front leg. So let's talk about the back leg. What's
me a
happening with
straight
that
left
leg? Is it abducted alien or adducted?
Adducted. Adducted.
It's adducted. So if it's adducted, it's stretching the
The outer, the mid and the
mid
mid.
because those are abductors, okay? But also it's stretching the other muscle, glute max, because it's an extensor, but she's in major flexion.
What is there a proper name for that? A yoga name
It's just-
or just a cross-legged form?
It's Uttanasana variation. There's a lot of variation.
Variation, yeah.
Okay, all right. We're good to move to the mat. We should kind of cover a little
I
bit.
didn't do strength.
Oh, sorry. That's right, because we had to change the order.
Yeah, sorry. Okay, so we have Chatupada Pitcom, which is 4-footed tabletop.
Show it.
It's not Purvottanasana tabletop?
I have Chatupada.
Show me.
I didn't actually. Well, one of them. Yeah, that was a max. That?
That's not a min or mead.
Oh, maybe was
That's
it this
not a
one?
min or mead either.
Okay. Well, I know Nadarajasana does that, right?
Show it.
This,
Show it.
that one? Ooh. Okay, that's another way to do it, yeah.
Is it?
That's straight.
Is that?
No, that's still getting, these are all max things to show.
Is
Okay.
that? I think I'm adding to my list of max.
Listen, if y'all,
What about people
And then I
are
have
one-legged balance?
Uttita.
okay, hold on. Yes. All one-legged balancing poses, you should have that glute med active. It's not on the top leg though, it's on the bottom leg.
Okay.
It's the bottom leg. Did you understand that about that?
So when you're in
Why?
Vrikshasana or whatever, because you're
Because it's a stabilizer.
It's
Like I
a
was like,
stabilizer.
I
It's a stabilizer.
Standing lead.
They can stand stand in tree pose like this, and the minute you tell someone
Pull up.
they're like, woo, and they
Right, and so when you go to someone and you say, okay, do this,
lift up.
and they say to you, because your students will argue with you, and they'll
Oh,
say,
they do.
no, I do it better like this. And
Yeah,
then
but
I'm like,
that's the
but
pose.
no, because your glute med is gonna be really weak, and you're gonna overstretch it here, and you're not doing it right, because it's not stabilizing here like you should, so do it like this.
Well, I make them stand at the wall and literally like stand there and get strong in it, so because they do, they'll let go and I'll be like, well, this is like the easiest
Right, and so
pose.
they're
I'm like, "No,
hanging
it's not."
out on their
Yeah.
ligaments.
Well, isn't that hurting the knee too? Because the knee joint is moving.
And if your hip ain't right, or if your foot's not right, it's gonna affect the whole body. So yeah, it's not good for your knee, it's not good for your hip, it's not good for your ankle. So this is hanging out in ligaments. And this is not good.
It's kind of super modelly though.
Right, and so stretchy yoga students that come to your class, they're gonna, be able to do this.
Well, I stood
And
in it
they
like that
need
for
to do
years because I'm real hyperflexible. I'm like, oh man, I'm nailing tree pose. And then I read something, I was like, I suck at tree pose. It took me like weeks to get back into the strength.
So where did you read about the standing leg? Because that's good that you.
Because in our anatomy,
It said like the sentence.
Good. So, right, but did y'all, yeah, so anything one-legged, the glute med should be active on the leg that's on the ground. So, yes, so you're right. That single leg dancer pose where you do it like this or go all the way around, that bottom leg should be active. So, any other single leg yoga poses?
Warrior
Three.
Ardha Chandrasana.
Ardha Chandrasana gets, but Ardha Chandrasana gets, well, it's not really getting the bottom leg. It's not, I mean, maybe a little bit, but it's a lot in the top leg. The bottom leg,
About the
yeah.
standing splits?
Yeah. Standing splits.
Standing splits if the hip is stacked or both ways.
If it's stacked, definitely the top leg.
If it's
And
stacked.
if it's not stacked, more so with the bottom leg, but it's getting a little bit of the bottom leg. It's tricky when you start to stack.
Yeah.
That hip still needs to move in. And as a matter of fact, and when you go into, if you think about it, if you go into Parsvottanasana, if you're doing this, like I was showing you, like your students will do, they're really needing to activate that muscle and scoop it in. So they're activating almost, if you think about it, the glute med in men and stretching the max.
So Parsva would be a good strengthener.
Parsvo,
So-
well, don't think just because they go into Parsvo they're strengthening. When you see someone with their hip popping out, they need to scoop that hip into the socket to get that muscle active because it's doing this.
If you tucked like if someone was in Utthita Trikonasana and you're kind of rolling that bottom hip under for them, would that work that area too? Like when you see them and they're in it, but they're
Kind of forward folded.
yeah, they're kind of all, so if you kind of, would that work here or am I way off?
No, they do need to have that hip externally rotating and that hip moving into the socket in triangle pose. She's talking about triangle pose. And a lot of people are forward, but that's because they're too low and they're compensating for their hamstrings, and they may have some tightness in their quadratus lumborum. Okay, so that's a side muscle that restricts it. They may have some tightness in rotating and side bending. The quadratus is a major side bender, and it's tight. It can be really tight on some people, and so that Trikonasana is a tricky pose because there's a lot of things that would cause them to flex their trunk instead of rotate it.
Okay.
And so, yes, this is one adjustment that needs to be made, but mostly it's in the trunk rotation
Usually
and
more lift.
more lift. It's because their hamstrings are in the way,
Maggie,
and adductors.
in an inversion, aren't the gluteus medius used to prevent the legs from splaying out, like in Shirsasana? Like to help support the upright?
Those would be adductors that are keeping the legs together now.
Oh.
You're talking about like this instead of like this, and headstand.
Or you mean like rolling the knees? You know,
Well,
your knees
just-
roll out? Is that
Don't
what
you
you mean?
use that to support, just keep them from falling
In headstand,
upward?
in Shirshasana.
Yes.
Okay, in headstand is one of those tricky ones. We're going to talk about headstand mostly with the upper body, so the arms and rotator cuff. But in headstand, mostly what's stabilizing you is your trunk. So it's a balance between your extensors and your abdominal muscles. So it's happening here. And so yes, when there's a little tuck of the tailbone, you may feel a little squeezing of the glutes to help you get that. The pelvic floor muscles are active. The adductors are active. Everything is sort of in a stabilizing mode because you're in neutral, you're like this.
Right.
So it's a lot of core, a lot of upper body stuff. And yes, the glutes, if you stuck a needle in there and did EMG, they're gonna be firing, but not like they are when you're doing this or squatting.
Okay.
So I'm not gonna say it's not active there, but it's neutral, it's like this.
Okay.
What about Utkatasana?
For the knee,
Medius and mid?
not really, unless you're like doing this. I wouldn't say. So let's go to the glute max, because that's gonna get those.
Did we do the strengtheners for the what were the strengtheners?
Anything in a standing leg, yeah, anything in a standing leg,
Is the grounded leg was the support, because you said don't pop your hip out. When
right.
You tuck your hip
So
out.
anytime you're standing, Parshvottanasana, tree, any kind of single leg standing, that hip needs to scoop into
And
the
that's
socket.
keeping it straight.
Yeah, but also, I mean, does anyone, I have some creative things that I do with my class. Can anyone think of ways to strengthen that in a less traditional yoga way?
Fire hydrant.
Yeah.
Yes, she's talking about this one,
Mm-hmm.
like that. Okay.
Oh, what? I was thinking, when I go in Urdhva Dhanurasana, I always have to force to keep my legs in. So would I be using my gluteus medius
Show me.
He's
without
talking
warming
about
up?
he's talking about full wheel, Irvidon, full
Full
wheel.
wheel is adductors are working there. Your
Because you're squeezing in.
Your abductors are trying to really work, and because you're trying to get the knees to splay when you go up into a back bend. I'll do bridge instead. So when they're really overworking. You're having to use your adductors in here to keep
I
the
think I'm
knees.
just getting the two misconstrued.
Yeah, you are.
So you're saying bridge and wheel don't use the glutes?
No, he's talking about the men and the
Okay.
knee.
So that's just the maximus for bridge and wheel.
Yeah, but what he's at, we're not even talking about the max right now. What he's asking is, don't the glute med and men have to work in bridge and full wheel? I call it chakrasana, but to keep the knees from splaying. Actually, what's causing the knees to splay is overworking of the knee.
Oh, okay.
And you need to use
And a
your
weak
adductors.
to pull it in.
Well, and think about it too, so you've got the one on the outside that we're kind of talking about and some others, and then you've got the inside that are working together. Because when you're moving your body, like she said, you're not moving in isolation. It's
You have agonists and
Together.
antagonists, but yeah, these muscles that cause you to do this will also cause you to splay in a back bend. Yeah.
I do gate pose where I lift and lower the straight leg.
Yeah.
Is that maximus or is that medius too?
Hold on, you
Gate.
I love that
gate
pose.
when you lift and lower here?
Yeah, you put the hand on the hip and they flex the foot and lift and lower. It really gets.
Yeah, definitely. That's a good one.
Is it for all three of the glutes?
And any
No,
of the
because the glute max,
Vassasana.
we're gonna get to the max, poor thing. So it's an extensor and external rotator. So you're
So
just
gate
going,
pose is really maximus.
it's an abduction action. So it's mid and mean.
Yeah.
Oh, it is mid.
Because
Okay.
you're lifting
Yeah.
the leg. Isn't that what you're saying?
Because she's doing this is
Right, and then
my leg
pulling-
is abducted, and then she's
Yes.
abducting it even more.
And then Maggie, show the Vasyastasana variation. You can go do it from gate.
Yeah.
Vasisthasana from gate.
Where the bottom knee's on
You
the
just
ground.
take the bottom. You just take this arm down, right?
Oh, the one that I
Yeah.
I do Vasisthasana. I do this in class like this.
Yeah.
I don't
And
like
you
to
can
go
point
up
every
from
time
here to
you
here.
circle.
Yeah, this is harder.
Little movement.
I do little movements because try it on your own. If you go down and up, it's not as effective as going up. Getting that muscle
It's
working.
like a crunch almost.
Like a
Like,
pull.
do you know what I mean?
Right.
Okay, same idea.
Yeah, and y'all want to get creative. You can do your poses static. You can do dynamic. You can do pulsing at end range. You can go through full range. You can have so many ways of making your class interesting and different by approaching how you do them, the poses differently. Some things work better going from full range of the muscle. Some things work better going to end range and pulsing. But yeah, that's when I do the Vasisthasana variation.
Yeah.
And if you're in Ardha Chandrasana, you can, very advanced classes work here. You can do that down dog split.
You're
Like,
right.
okay, so while you're there, might as well pulse a little bit, get a little, get it stronger. Or it could be an option you give to a multi-level class to work on a more advanced variation of it, since it's a balancing sort of, and you're moving in the balancing. So
But this is all just the medius.
medius, it's abduction.
Okay. Medius and min, I mean, they're kind of doing it
Together.
Yeah, me and men are together. Max is different. Okay. Are we ready to go to Max?
Yeah.
Okay.
all right. So the origin is the outer posterior surface of the ilium. So now I know the ilium is here.
And you call it a rim? It's fine. It's fine if they didn't.
The posterior surface of the sacrum and the coccyx, and the erector spinae muscles at the back. Has that any pronounced?
Yeah, it's not attaching to any muscle.
Okay.
Is that what? Where did you get that information?
From the coloring book.
Okay, let me see it while you're doing that.
Okay. I'm not
Because
gonna-
it's really not. It's really kind of, it's on, it's
Oh, no.
probably the fascia.
No,
that-
it's
This
actually
book, yeah, 'cause I wrote this.
See, that's why I hate that book. I think that's why
I know.
Let me tell y'all right now, I have some references that I can give y'all. There's a website called Functional Anatomy, and there's one called Muscles in Motion. The Functional Anatomy website is 3D. You buy it, you get a year's subscription, and it'll show you the poses and what muscles are working. But I looked at that whole thing. I did a test trial, and then I purchased it actually, and then I couldn't get in with my password. So I'll tell y'all I'll give y'all some things that you can look at and tell you issues I had with them, but I gotta tell y'all, I see some things in there that are not right. Okay, so if you don't know, you're gonna think it's right.
The ethnoneursis of the erector.
Okay, the aponeuroses. Okay, so that's
I left out
fine.
a keyword, didn't I?
Very much. Okay, so this whole area has a lot of fascia, and a lot of things come to the fascia. So your lats will connect to the fascia, glutes will connect to the fascia. There's a lot of things that come to the fascia. You'll see a muscle, the tensor fascia lata, a little bit later that attaches to the IT band. It's a connective tissue. So not all muscles originate and insert right on the bone. They really don't. They all insert some kind of connective tissue to the end of the bone. So because it can't reach a bone here, it's touching the fascia. It's more superficial than deep. So it's coming to this fascia. You have muscle, fascia, bone. It's never muscle to bone.
Is it the tensor fasciae that it's coming to? Or
No,
is it
it's the fascia of the back extensors. But you really need to know, you really just need to know ilium. That's a little more detail than y'all need to know. It's ilium, and then, what do they call that? It's posterior lateral sacral. They said posterior, but.
Posterior surface of the sacrum and coccyx.
Yeah, so kind of like around here and here. So it's all through here. It's a big fan, so it's
Maggie,
going.
can you kind of do it from the other side?
Yeah. You, what do you mean, like? You want me to
Like
move?
stand behind it, maybe,
Yeah.
so we can think.
So it's all through here. It's all here, and it comes and attaches here. For the greater trochanter. So it's a big fan. So make it like a fan. It's all coming like that. Okay.
So how did you word the origin again, sorry?
It would be the crest. It would be the crest of the ilium, posterior ilium, sacrum, and coccyx. But it's not like right on top of it. It's just kind of like where the sacrum and the it's like kind of where the SI joint is. But it's worded differently everywhere. Let me see how I worded it in my notes. I made this one very simple for the purpose of just what we need to know for yoga. Posterior ilium, sacrum, and coccyx, and then greater trochanter. And are they calling it the ilio? Did they say iliotibial tract on yours? No. Okay. They said greater trochanter for that book.
No, it's ilium. And posterior.
No, the insert.
Outside of proximal femur bone and on outside of ice.
Okay, yeah. So it's kind of attaching to this area where the IT band is. What does it say in your coloring book? Are you looking at yours?
Well, I know in the massage book I was looking at, it does say that it has two insertions. It says it inserts on the greater trochanter and into into some fascia.
Yeah. You know, if you look at, okay, real quick, Wikipedia is good for the pictures, for the origin and insertion, because that's coming from a legitimate anatomy source. The literature in Wikipedia can be changed by anyone, I think, and I don't know how it's monitored, but if you look at Wikipedia's origin and insertion, if you look at Gray's Anatomy, if you look at your coloring book, if you look at these books, they may word it differently. You just need to know the general area that it is, because there are some that are more specific than others, some that call certain things different names. So you just need to know the general area of the muscle. Because don't get caught up if one thing says one and the other says the other. It's just that one may be more detailed than the other. Okay? This book isn't wrong, because she forgot the aponeurosis part.
Sorry,
which
I
is-
was trying to.
Yeah.
I leave out the word that I couldn't say. Okay, so for action, I put from the coloring book, adducts and laterally rotates hip joint. Is that right?
Adducts?
That's what it says.
No,
but
where?
I'll show you.
No, show me.
That's where I put too.
It's an extensor.
In my book.
Yeah.
Wait a minute.
Adducts and laterally rotates the hip joint.
Okay.
It is the most powerful hip extensor of the lat and adducts and laterally rotates the hip joint. It is a tensor of the back.
Okay. It is an extensor. And it also externally rotates a little bit. And if you look at where it is, it may cause a little adduction. But don't think of it as an adductor. Your adductors are your adductors. Okay, that's an extensor mostly. If you remember anything, it's an extensor, and it may externally rotate. And if you see where it attaches, you see that doing this will shorten it. This is external rotation. Okay, you see how that would shorten it? Do y'all see that's shortening? Mm-hmm. And you see this is shortening? And so yes, maybe if it's back and goes in a little bit, it might, but that's like an accessory movement. Okay. All right, that was that's very, very detailed information. So that is fine. Most muscles aren't just doing one thing because we're not like this. We swirl. All right, let's think of it as extension.
Okay.
Because if we think of it as adduction, we're going to get to, it's going to be unnecessary.
Okay. So to go to the poses, strengthening poses by special request. Stretching ones. Okay. So I just added some based on our previous discussion. So I added Parshvottanasana that Carolyn demonstrated. And
Parshvottanasana.
Is that what we just?
Parshvottanasana?
That's part. Wait,
This one was.
that's Parshvottanasana. Okay.
Okay.
But which leg?
Oh. The back, right? Lengthening the glutes.
Because the action is to pull back, so it would be. Okay.
The action is hip extension. The front leg is in hip flexion.
Okay. So it would be the front leg that's lengthening then.
Well, okay, the forward leg is stretching in the back, which is where your glutes are. It's confusing.
Yeah. Okay.
Okay, so y'all see that? The forward leg, if my right leg, the glutes are active in extension, Parshvottanasana is you're in deep flexion, and so you're stretching that.
Okay.
Does that make sense to everyone, or do y'all need to get up and do it?
No.
Okay, so I had put, this is one we practiced a lot last night in Debbie's training. The Uttita Hasta Padangusthasana.
Uh-huh.
It would be the standing leg.
Right.
Yeah.
Okay, well, right.
I mean, not the,
Yeah.
it would be
the
extended leg.
floating leg, yes.
Yes. I had put Virabhadrasana 3 as one that both strengthens and lengthens.
Which one?
Okay. This would be
Strengthen, because it's going in this direction, right?
Yes.
It's an extensor.
Yes.
So the back leg is an extension, so it's strengthening the back leg.
And it's lengthening in the standing.
Okay.
Or is it?
Yeah. Okay. If you're in Warrior 3, let me see how I can do it. Okay, so if you're in Warrior 3, the lifted leg, I'm contracting my glutes, so they're working in that sense.
Okay.
And the bottom leg, I'm stretching my glutes, so they're lengthening in that sense. But this leg is also working. The glutes are also working on the right leg. Did anyone see that in any of your fancy anatomy books? Did anyone see that in anatomy books?
That being eccentric?
Yes, ma'am. Okay, so that's where anatomy gets very complicated. And as a matter of fact, this leg, which is on stretch, is working harder than this leg. So if you're like, I'm working my butt out, you're really working this butt out better than the other one, because it's working eccentrically in a lengthened position. Okay. So I'm going to talk about eccentric real quick. We're going to continue to talk about asanas, and then we're taking a mental break. I know y'all need one, because I need one, and I can tell you. Okay, eccentric. Anytime a muscle is working hard against gravity, which is pulling it into a lengthened position, that's eccentric. If you're a gym person, it's called negatives. Does anyone know what a negative is in the gym, which is eccentric? Right. So can you give me an example of a negative that y'all would do in a gym?
For a chest press.
Chest press is a very common negative. Right. So your pecs, we're going to talk about it in the upper body, but basically your pecs do this. So you've seen those guys in the gym where they're doing this? What they do is, you ever seen a big guy over them, helping them? Mm-hmm. What they're doing is, they're pushing up more weight that they can push up with help, and then that person's helping them descend slowly. The pecs are going into stretch. If they didn't work the pecs as they were stretching, they would go like this. So they're lengthening slowly, 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 slowly. Gravity is pulling those weights down into a stretch position, and the muscles resisting that stretch. So that's why the glutes are working more in this position in a lengthen and eccentrically, because gravity is pulling the torso this way, and which would make the glutes longer. And the glutes are fighting to not fall down that way, which is making it work eccentrically.
Same thing with the lunges, right?
Yeah.
In the front leg.
In the front leg.
In the front leg.
Hold on, let me get my snacks because my blood sugar is dropping, and then we're going to keep talking about the glutes. It does that. Okay. So when a muscle is working eccentrically, it's getting stronger than it would concentrically. It'll build more muscle that way. Say that again. An eccentric contraction makes the muscle stronger than a concentric contraction.
Should I go to strengthening poses?
Well, keep going with the stretching, and we'll address,
Yeah, wasn't Ekapada Kapotasana a good one with the forward leg?
Yeah. So that's a stretch for the front leg.
Prasharita Padasana we had.
That's getting it. Yeah.
Okay.
The back, both of them. Yeah.
That's all I have on my list for lifting.
Anybody else have for stretching?
What about forward fold?
Yeah, she had this wide leg forward fold. Uttanasana gets it.
No.
Both more of a core. Oh, both.
Oh,
No,
chair
both.
pose.
No.
Utkatasana?
Both. I think you said both.
Utkatasana, will that stretch it?
Well, hold on, don't tell them. We just talked about that. So Uttanasana, what's happening with
I mean, you're active there, but doesn't it stretch it and strengthen?
It's lengthening it and strengthening it.
Eccentric.
And so there's a difference between
eccentric thing.
Yeah, so it's a difference between lengthening or in a long position and stretching.
Okay.
So yes, it is lengthening, but it is working super hard that you don't fall down on your butt.
Right. Okay.
Like the eye of the needle and or the knees to chest when you're on your back.
Knees to chest. What would y'all call that in Sanskrit? Apanasana. Oh, is that wind relieving pose? That's why I don't know that.
Yeah.
All right, everyone, we're doing wind relieving.
Wind relieving.
What about squats, garland? Is that stretching the glutes?
Garland?
Garland, squats.
Oh,
No,
this
like
one.
Oh, yeah.
Malasana.
Yeah, it's putting it on stretch.
What is that one called?
Malasana, garland, there's a bunch of different variations of it.
Okay, do you understand?
Yes.
But we can put that if it's on this. That's where I got confused with this homework was if it's an eccentric stretch, you put it under stretch or strengthen because it's doing both.
If it's eccentric, well, I put on there strengthen and stretch, right?
Mm-hmm.
Okay, and then that's why we're here. That's why that's not enough for you. If it's a stretch, it's not working eccentrically. If it's working eccentrically, it's lengthened, not necessarily stretching it. So think more of pigeon in the front leg as it being a stretch, because it's not active in its long position. So think more of a stretch as passive lengthening, and strengthening more as contraction or active lengthening.
So you put the eccentric stuff under strength.
Absolutely, I would put that before any contraction, really, because it's making it stronger.
It's the most efficient way to strengthen.
Yeah, so it is lengthening, but it's strengthening.
So really, the part where it says stretch, what we should be having is lengthen there.
Passive lengthening
Passive
versus active lengthening. Which I would say active lengthening equals eccentric equals strength. And that's okay,
But doesn't it do the same thing? If you're lengthening it, does it matter if it's passive or?
You're gonna get more of a
active?
stretch out of a passive lengthening
Okay.
and more of a strengthening out of an active lengthening
Okay.
than a stretch.
All right, I get it.
That make sense?
Mhm.
Okay. It is lengthening, but you're not gonna get, like if you're like, I really need to stretch this muscle out, you're not gonna do Utkatasana.
Right.
You know what I mean? You're gonna do pigeon.
Right.
So. Okay. Any other stretching? That's good. I think we have enough. I mean, we get it, right?
Yeah.
Anything that's a major flexion of the body.
Okay, for strengthening, Utkatasana, which we were just talking about. Dhanurasana and Ustrasana. Oh, okay. I added the tabletop that Kevin introduced earlier, and
Okay, does anyone need to see tabletop Purvottanasana? Yeah, I'm sure someone does. Somebody does.
Your kitchen, somebody.
Kevin can do it again.
I want you to go to the deepest pose you can without warming up.
Oh.
We specified the long leg one. I was actually
Oh,
looking at strength when I said Utkatasana.
Good, okay.
This is another.
On that one.
Okay. Kevin's ideas, and he already just demonstrated, was the Purvottanasana. Is that how you pronounce it? Purvottanasana?
Purvottanasana?
Oh, Purvottanasana.
It's tabletop.
Yeah, tabletop.
Okay, with the legs.
Purvottanasana.
Okay. Demonstrate Purvottanasana.
And Dhanurasana.
Um,
Right?
yeah, well, he's gonna need blankets for Dhanurasana because his hip bones for sure if he feels his
Yeah,
grip.
yeah.
Okay, this is a major glute one, but let me tell you, a lot of your students are gonna have a hard time getting their glutes because they don't have enough strength to lift enough there. It's hard for me too, and also if someone's pecs are really tight,
Right.
they won't be able to lift enough to get their glutes. They're gonna get mostly a pec stretch. So this is a super duper advanced one. A better one would be,
Dhanurasana.
well, do the bent knee Purvottanasana.
Oh, the Ustrasana?
No, you do the same thing you did with the knees
Tabletop.
bent. Yeah, tabletop.
You don't need the blanket, yeah.
Yeah.
You don't even know. He was confused by the blanket.
Still a pec stretch, okay, but a little more access to the glutes.
What would happen if you extended and lifted the leg up?
If you extend it,
Take the one leg
So
and
your heel, and then go up.
yeah, you go up as long as the butt doesn't go down because then the butt's not working, so your glutes aren't active.
Okay.
So you have to
keep your
catch
hips
those
up.
things where a lot of times it's not like, oh, if you do this, your muscles are working. If you do this, watch your students for where they're not working the right muscles. And you see how when you lift the leg, yeah, it makes it harder. It's more advanced. Okay, so that works the glutes, but it's hard to access them because it's so advanced. And y'all know this. If you do something that's too hard, you won't necessarily get the right muscle. You'll compensate. So even better, sometimes less is more. All right, so let's back up and do something. What was your Dhanurasana?
We'll do Dhanurasana and Ustrasana as well. Camel.
In Dhanurasana and Ustrasana, the muscle is shortened, but it's not necessarily working that much. Yes, if you stuck an EMG in there, it'd fire. But they're mostly in a shortened position, and it's they're kind of passively shortened. Does that make sense?
Because tendency to clench too much
you clench,
too, and
yeah.
I think people have a tendency to clench too. And then are they working what they're supposed to be working, or are they just clenching?
Yeah, well, in that one, I would maybe encourage to not clench.
Right,
If
exactly.
if it's like visually obvious someone's clenching, then they need that maybe.
I think Dhanurasana, Shalambhasana, Ustrasana, the whole back body is working.
The whole back.
Because of the extension of the position.
I know it's hard to think of it that way, but if you think about it, when you're in bow pose, your legs are going up, so there is a little extension. Hamstrings are very active, glutes are
Right.
contracted, but mostly it's this, the leg is going this way and the chest is going this way. So there is an up action, but it's a lot of a stretch action in the chest. And so what's really working is your quads are working in a long position. And do y'all not feel your quads when you do?
Oh, yeah.
You don't feel the glutes, you feel the quads. And so it's like, yes, it's gonna give you a signal if you stick an EMG needle in it, but it's mostly this extension right here
Yeah.
that's working more so than the glutes. And so my point is, no, it's not that it's not working, but I wouldn't make that a glute strengthening pose.
Is that the same
Do you
for
see what I'm
like,
saying?
Yeah.
I put warrior 2 down, so warrior 2 be, or is that?
For the front leg, because it's eccentric. It's like Utkatasana.
Well, and I put Garudasana down there too.
Yeah.
Yeah, which is also
Oh,
eccentric.
definitely.
Yeah.
Oh, it's like a single leg squat. It's really working here.
Yeah.
What about bridge pose? Just as like the more simple version.
Definitely, yes. And you can make that pose, you can make it as creative as you want. So now Ustrasana, same thing. Ustrasana,
Which one's Ustrasana?
camel pose,
Oh, okay.
going down like this.
Yeah.
I would say it's mostly like Dhanurasana, a stretch for the front of the body. The whole back of the body is shortened. But would you make this a glute exercise? No. It's more of a quad stretch, a hip flexor stretch, a chest stretch, and a deep back extensor. But it's a joint thing. It's extending in a joint way. It's not so much a exercise for the extensors. Does that make sense? It's shortened more passively.
What about Salamvasana? Does that mean
Shalabhasana.
That one.
Yeah.
You are, yeah.
Well, that one, if you lift a little bit, you're getting the multifidi and the extensors in the back. If you lift a whole lot, you get a little more of the glutes. But it's not, I wouldn't use, maybe a single leg, Salamvasana, one leg at a time, or something like that. It's a really good back extensor. If you do lift a lot, some people have so much tightness in the front of the body, they can't lift enough in Salamvasana to completely fire the glutes. Again, better than Ustrasana and bow, but I wouldn't use it as a glute strengthener. I would really take advantage of your.
What about Parsvakonasana? Extended side angle.
For the front leg?
For the
I mean,
front,
it's the same thing
for the
as
front
warrior
leg.
2, right?
Parsvakonasana?
Parsvakonasana.
Sounds
The front knee is
similar.
bent.
Oh,
Extended side
yeah, side
angle.
angle. Sure, and so, okay. If you go into Parsvakonasana like this, I'm taking the socks off. If you go into this like this and you're really pushing down into your hand is really helping you. If you take your hand off the floor a little bit or push less, you are working more, and it's working more in an eccentric position.
I was thinking more of having the forearm in the middle of the leg.
Yeah, let's all do this. We are going to take a break after the glutes. I want you to take the socks off and come into a lunge. Let's bring the right foot. I want to do the right foot so I can make more sense instead of saying front back. And these are good things to know because it's going to help you work the muscle less or more, and it'll help you be a more of a multi-level teacher. Plant the back foot at an angle, setting up for Parsvakonasana.
You good? Yeah, this is it.
Yeah. All right. You can either have your, is your right leg forward? That's your left leg. Bring your right leg.
Right leg forward.
You can either have your right hand down on the floor. I don't know if some of you have blocks, or on your thigh. Left hand to the hip, and then rotate the front of the body to the left. All right, so get in your position. All right, what do we want to do with the hip on the right, by the way, just since we've already discussed it?
Tuck it in.
Tuck it in, right. So it's also external rotation. That front thigh will help you activate those glute med in a minute. Okay, here we go. Now, whatever you're on with your right arm, whether it's elbow on thigh or hand on floor block, lift that pressure up a little bit so you're not really using that support, and you should feel your glutes working a little bit harder. That way you can give your class a more advanced side angle stretch by working the glutes more eccentrically. Y'all feel that? Okay.
What should you do with your, do you suggest like putting your hand parallel?
No, I really suggest on the top of that triangle that you come into the position, whatever you're in first, and then just let up a little bit.
A little bit?
Yeah, or as much as you want.
Just so you can feel that
Find
action.
your level of action, yeah. That way you can get more out of the pose because you have less pushing down and supporting, and you have to have more work in the muscle.
Because you're keeping your,
Because your arm is
everything
keeping you
will just
from
collapse.
collapsing down.
Right.
And if you don't use your arm, you have to,
turn that on. So
right, instead of your body going like this, which is more stretch, it's having to fight that.
Right.
That side.
And you'll see your people there in the triangle pose too, all their weight is on their arm because they can't access their legs or whatever, and they're just, you can see them, they're like leaning on the arm like this.
Yeah. Now, I do see some people do like this, and I teach triangle a certain way for a reason, but I teach it always coming into it from a bent hip, because it can really, if you go into it incorrectly with really tight hamstrings this way, it's a common sit bone and adductor. One of your adductors attaches to your sit bone. It's a common pose for injury, and I would recommend if you do triangle to have them take some of their weight off, but not just completely hang in the air like this, because then they're sort of hanging out on the ligaments. I do not ever teach it coming in like this, because the hamstrings and adductors are a common place of injury because they're weak and tight. Adductors tight, hamstrings tight.
I noticed that when I was in the lunge and took any weight off, I immediately like kind of sat in that hip, and I had to think like, okay, like maybe I'm doing that and don't realize it.
Yeah.
In my practice.
Right, and we very flexible people especially, but everyone can hang out in the joints and hang out in the ligaments. And I think that's a big problem in yoga, is that we focus so much on stretching and getting deep, and we don't work on this sort of
Core, yeah.
and then the core gets stronger sort of on automatically, but you can do even better. We can do better.
So Mike, you said for Min and Mead, it's the one leg standing poses. So for Maximus, that doesn't apply. Would it have to be like revolved, half moon to get into
No,
that?
the max may be working a little bit, but if you're like this or like this, like in tree, it's not working that much. It's active, but it's not necessarily a really great glute max strengthener. It's more stabilizing the body.
Okay, so
Is
like
that what you're
revolved
asking?
half moon, that's not really getting into Maximus. That's
Revolved half moon.
That's still Min and Mead.
No, your glute max on this side is working in an eccentric position on the bottom leg, and even the top leg for extension.
Yeah.
Mhm.
I don't even think it has to be revolved, just half the moon is pretty.
Yeah.
Does half moon get into Maximus too?
The bottom one for sure, for the max, yeah, because it's working eccentrically.
What about this, like, this one?
Bird dog.
Yeah.
That's.
Extend back extensors and glutes. It's not the best. It's not the best.
Bird dog.
glute.
Bird dog. There's a bunch of variations of it on the floor.
Is there a Sanskrit name for that?
I don't know.
Okay. Uttanasana. When you go into Uttanasana, if you go into it like this, you have a lever arm. Think of a lever arm. So from my head to where my hamstrings connect, or where the glutes are, you have a lever arm. So it's this long, right? If I reach my arms out, you have an even longer lever arm, so it creates more weight farther away from the muscle, which makes the muscle work harder. So if you do Uttanasana forward folding here, it's not as intense in the glutes, which are going into a lengthened position, as if you do this. So you can definitely strengthen your glutes in coming into forward fold, and we'll talk about the hamstrings when we get to that.
Would that make Warrior 3? Because then you're working with that
Warrior
same
3 would
lever,
be
so you're
easier
really
here,
right.
here,
Okay.
and then here.
Easier or
Easier here, here, and harder here.
okay? So when
Yeah, this is how you
It's the
progress.
same thing like Shalabhasana on the ground,
Right.
right? Belly down, back bend. The arms are forward. It's heavier than having the arms by the
Think of a
side.
lever arm. The farther away weight is from where you're working.
Center of gravity.
Okay. All right. Where's the max? Oh, so did you get everything you wanted on your list? We did. Anyone else want to add anything about glutes? Question about the max?
Can you talk a little bit about the glutes in relation to back health?
Um,
Is it too much to go into?
No, I mean, the thing is, I wouldn't necessarily, it's like directly connected to it, but your glutes are part of your core, especially the meat and men, because they're really deep. And so I just would think that you just want all your core muscles to be strong, because if you have an issue here and you're walking like this, or not completely, but there's some of that going on that may be building up to something, that's going to throw the back off and everything like that. So it's just important for all the core muscles to be strong and all your muscles to be balanced. Because if one side's a problem, it causes kinks and issues and compensation and other issues. So I think that is really all we need to kind of talk about with that. The glutes tend to be weak on people because they're not really active with walking. And so in that sense, it would be good to focus on strengthening it, because we're not really using it unless we're walking up hills and hiking and hunting our food, which we don't do anymore. We drive and get our food, and then we come home and we sit down and eat it. You know what I mean? So we're not working for our food anymore. Our muscles aren't as strong. Our bodies are a little bit healthier. You know what I mean? A little more body fat. But so in that sense, it's good to know that the max tends to be weak because it's not active in regular walking.
I
And so
can
that
see what you're saying in terms of strengthening I had a fusion on my L4 and my L5 when I was 11. So, and it was 75 degrees, so it was a pretty severe one. And so I find when I'm sitting, it's very easy with that to sink, and so I do tend to keep that lift, and so I have to work my glutes in order to
that's
keep
more
that
your
lift.
quadratus that's causing back extension,
Yeah.
not so much the glutes.
Okay.
But
But
so
the glutes are strengthened, like I push up through those to get my lift in that area. Like if I'm grounding.
like in this position?
Yeah, so if I'm here, it's really easy for me, and it's just because I have a weird shape back
Yeah.
because of that. So I work my glutes in order to, like I push out. Maybe I'm not working my glutes.
You're working your quadratus femorum and your
Yeah.
back extensor.
Okay.
But that's good that you do this because we should, because a lot of us slouch too much. Okay.
What about the staff pose, like what she's in? Is that a
Dandasana?
what is that doing? Is that,
It's lengthening the glutes.
But just passively?
I would say it's pretty much passive there. They're grounded, they're just long. You're working your quads, you're stretching, you're working your quads, you're working your anterior tib, you're stretching your calves and hamstrings where they cross over the knee. There's lengthening happening in the glutes. And if she's sitting there with proper sitting posture, she's working her quadratus, which is a core muscle.
And would chaturanga fall in that category as well?
With what?
The glutes?
Chaturanga?
Dandasana?
The glutes. I mean, you're neutral.
Okay.
Yeah. It's core.
Maybe
It's
I'd
core
just use
here.
mine for
What about when you pull back to up dog from there? I'm like, isn't that kind of nature?
That's what he was thinking.
Yeah, I feel that's
That's yeah.
Does it?
Hip flexors, core.
Oh, okay, she's core.
Yeah, because
Okay.
go up into down dog. She's flexing her hips, and you have to use your tummy to help you pull into it. Just like with plank, you have to use your tummy so that you're not falling into too much extension in the back. We'll get to that. Let's take a break. I think we all need a mental break, and I hope you're not supposed to remember all this, but hearing this is